Hi, good day, arthritis warriors. I'm Dr. Jonathan Flordelis. You know me as Dr. Joff, your trusted source for hip and knee arthritis information. And I am here today with a very special guest. Sir, please do introduce yourself.
Hi, my name is Alexander Smith. I'm from the United States. I came to the Philippines to get my knee replaced from a great doctor here, and he did a great job for me.
Well, thank you very much, sir. So, Mr. Smith, please do tell our audience, the arthritis warriors, if you had some sort of arthritis problem in your knee, which is the reason for that knee replacement surgery.
Yes, I did. I had arthritis in actually both knees, but I injured my left knee at work, and I also had arthritis in my feet and in my hip. But the most damage I could cause when I fell and had an accident was in my left knee here. And that's how I had to get the knee replacement then.
Okay, so if I'm not mistaken, Mr. Alexander Smith, I met him about a year ago, and some of you arthritis warriors do have questions for Mr. Smith, and who had severe arthritis before we actually treated him with a total knee replacement on his left knee. Now, some of the questions from the audience, sir, Mr. Smith, they're about the pain. They're asking, how did you know if your knee pain was severe enough to warrant a knee replacement?
When I first had an accident, I was in a lot of pain. And a lot of doctors I went to before I came to you prescribed me a bunch of pain pills. So I really didn't know until actually they did an MRI and they see how much damage I caused by the accident. And then I went to other doctors before I got to you. They just told me just do a quick cleanup arthroscopic surgery. But you told me, no, you need a whole knee replacement because the damage is secure. So yeah, the pain was intense every day. I was popping pills constantly for the pain. And I didn't want to do that anymore. So I needed to get my knee replaced because the pain was excruciating. And after you take the pain pills all the time, you get addicted to it. And I didn't want to get addicted to the pain pills.
Okay. So mga arthritis worries, you heard that from Mr. Smith. Severe pain, medicines all day. He was popping pills and he did not want to be hooked on those medications. He tried arthroscopic surgery, and some of the questions from the arthritis warriors are, Mr. Smith, did you ever try any injections before having those surgeries?
Right. The first thing I did do is do the injection. That it didn't work. I thought it would work, but it didn't work. Then my next step was arthroscopic surgery. I thought that would work, but no, it didn't. So my last results was the total knee replacement.
So thank you very much, sir. So a total knee replacement is the last resort. For those of you who don't know what arthroscopic surgery is, it's a keyhole surgery where a camera goes inside the knee, and that can be helpful for minor injuries, but for severe arthritis, it is a totally different thing. So going back from the arthritis warriors questions from the audience, Mr. Smith, did you by any chance delay your surgery? What happens if I delay my knee replacement surgery? So this is a question which I will let you answer first before I answer.
Well, I did delay my surgery because during the time you scheduled it, it was my daughter's birthday. She was turning 10, and it was my wife and our 10th anniversary at the same time. And I don't want to go to surgery without celebrating those first. Now, once those happened, then I scheduled the surgery and got the surgery done on my knee.
That's very helpful, sir. Personally, mga arthritis warriors, I do recommend that you get everything in order because a lot of us have different priorities. And when your health becomes the most important thing, if you've done everything that needs to be done on your work, on your family, you need to be prepared psychologically, spiritually, then we will definitely know when the best time for surgery is. You can delay if you need to. Just make sure that when you do the surgery, the focus is on recovery and not focusing on getting back to work as soon as possible. So it's not just about waiting, it's about getting everything lined up. And for Mr. Smith, I believe it's very important to have that family support group to help you through major surgeries. And would you say that your family is a big factor in helping you recover, sir?
Yes, my family is. I have a lovely wife. I have two daughters that whatever I need, they're there for me to help me provide and get back to my normal activities and go back to work. So I can prepare and take care of my family. So yeah, they have my back, and
Yeah.
I try to have theirs.
Yeah, so it's really important that everything is in order, because my personal philosophy is we are a team, not me, the patient, and my staff. We work together to get patients to walk again without that arthritis pain. So there are questions about fears and the reality of surgery. So, question from some of the patients or from the arthritis warriors: I am scared of surgery, and I've heard horror stories and not being able to walk again. What is your experience, Mr. Smith, about this? How are, number one is, do you have any fears? That's the first question.
Yeah, I had a lot of fears. I thought maybe if something happened, I might lose a leg, or maybe I can never walk again. I'll be in a wheelchair. But after doing my own research, after talking to you and getting your information and doing my own research, I feel like the knee replacement is a good operation, and it's like a 99% sure that you will walk again and be better. And once I was confident enough to know that I would be able to go through surgery and be able to walk better, I was ready to go for it.
Okay, so thank you for that. The next question, sir, from the arthritis warriors is about walking again. Like, how soon after surgery were you able to walk, sir?
For me, it was less than 2 hours. To be honest, once I got back to my room after the surgery, after the recovery room, I got to my room. I sat down on the bed, and actually you came in and asked me to walk, and I walked like maybe like 5 or 6 steps, and I walked backwards. And that was like a couple of hours after surgery was over with.
Okay, you heard it here, mga arthritis warriors. Few hours after surgery, Mr. Smith was already walking. He had the same fears as you, but doing his research, he found out that it is over 90% success rate for knee replacement surgery. And this is how patients should be. Don't believe everything your neighbors say. Sometimes you will be scared by people who aren't really doctors or experts on the matter. So thank you, sir, for that. Other questions are with regards to readiness. Some are saying that I am too young or too old for surgery. I'm going to answer this. So, with regards to being too young or too old for surgery, my personal belief is that age is just a number. There are patients who are like 90 years old that I've done surgery on, knee replacements on. Oldest knee patient was about 101 years old. And the thing is, they all need to go through a medical clearance before surgery. So even if this 90-year-old is living alone by herself, very strong, we all need that medical clearance before surgery. Mr. Smith, why don't you tell us about your clearance experience with medical clearance?
From my experience, I'm a large guy. I'm 6'3". I was like 211 kilos. And the first thing you told me is, say, before the surgery, you probably need to lose weight to be better for the surgery and for yourself. So I lost almost 30 kilos before I even got the surgery done, because the more weight you lose, the more you feel, the more easy it becomes on the surgery and yourself. Even after the doctor told me that, I did my research, and they did say the same thing online too. That the smaller you are, or less weight you're carrying, easier on your body will be for the surgery.
Yeah, so very important. Weight is definitely a factor, but I need to also thank our team. So it's not just me who clears the patients. We have actual medical doctors We have cardiologists, anesthesiology doctors, and even a lung doctor on board. Isn't that right, sir?
Yes.
And tell us your experience with the other doctors, please.
The cardiologist, Dr. Lasco, his name is, he gave me Ozempics to help me to lose the weight and also make sure my heart and everything was right. They also had another doctor, I can't remember her name right now, but she did for my lungs, make sure I had lungs taken care of, make sure everything is internal ready to go for me for my surgery. And I thank them for going through it. I found other issues that I had that got cleared before I did the surgery.
Yes, so you heard it from Mr. Smith, mga arthritis warriors. We do have a team that takes care of you, and it's not just about the age or the weight. We have a cardiologist to take care of your heart, and for certain patients, we also have a lung doctor. For patients who are diabetic, we get diabetes doctors. And again, we are a team that works together so that you can walk and without pain of arthritis. And that is part of how we get patients ready for surgery. So aside from being mentally prepared and having the family on board and aligned, we also have different doctors to take care of you. And there are other questions here from the arthritis warriors. Doc, do I really need a knee replacement? How do you decide? And can you fix arthritis without surgery? So I'm going to answer this. So, yes, arthritis warriors, we do have different options for arthritis. It just needs to be defined. And I have a special joint restoration blueprint for each patient. And that means that not every patient is the same. And if you go through my clinic, I need to check using my blueprint exactly what you have, because then I would know if you would need a knee replacement, whether it's an injection or an arthroscopic surgery. There are different options. Weight loss itself is a very big option for patients who don't want to spend anything. And it can help if you reduce weight, if you're feeling that you're a little overweight. Other things that how I decide, aside from the severity of arthritis, is also the pain of the patient, because some patients may have severe arthritis. Just the other day, a lady, 80 years old, severe arthritis, but she did not feel any pain. Her pain threshold was so high that her knee was swelling, but she did not feel pain. So this is also how I decide that she may not need the surgery if she does not feel pain. And lastly, fixing it without any surgery can be an option, but again, I need to be able to see you and fit you into my joint restoration blueprint, depending on what I see. So, thank you for those questions. And we're going to pause for a bit and we'll get back to you soon. I'm just going to cut. I think we've gone through 13 minutes.